That's fascinating. So we already touched on the Dynavision board a little bit earlier when we were talking about peripheral. Could you touch on that again, though, and like explain why you use Dynavision boards in your treatments for peripheral and reaction time, and then what people that can't afford to, buy a Dynavision board themselves, how they can get some of those same benefits?
Sure. So the Dynavision is an FDA cleared medical device. It actually is two old technologies, and I mean ancient technologies. It's based on the wane psychotic fixator, which was developed in the early part of the 20th century, as well as the chachistoscope, which as a mechanical device was developed in the 1800s. And those two are put together. So ancient technology. So that actually answers your second question. How can you get benefits separate of the Dynavision? You could do them independently. Just the chachistoscope, which now is, you can find tons of them on YouTube. They're just flashed images, and there are various tasks that you would have. And then the wane psychotic fixator it is a device, but it's pretty much for ocular motor assessing and training. You put those two together, you get the Dynavision. I like it because, again, it's an FDA cleared medical device. So we use it as part of our diagnostic paradigm and our baseline with our athletes. It's established technology from the 1980s. So the Dynavision was first developed in the 1980s. So there's lots and lots of experience with it for rehabilitation and diagnoses. Many neuro rehab places around the country have Dynavision or one of its knockoffs, if you will, that are used for things like reaction time for driving. You have to be able to react quickly to drive, and they'll use the Dynavision to say you can drive or you cannot drive. Not entirely. There's a human factor, but it's used there. The other thing the Dynavision is it's a platform that you can make your own programs, whether you want to just do something to see or establish a methodology. And we've done both. So we've established our own peripheral reaction training methodology. We've also established our own suppression treatment strategy. The lights are red and green. We can put color filters on a person's eyes, so there's red and green, and they have to use both eyes to be able to see all the buttons. So that's a suppression training modality, which occurs fairly commonly post-traumatic brain injury. One eye doesn't work as well or as much as the other. So it's a flexible platform. And the summary of the answer to your question is, I like it and we use it because A, it's an FDA cleared medical device. It's got a tremendous history. It's got an established platform. I can say I did mode A star, and for 1 minute, and a person got 75, and tell that to anyone around the country, and everyone more or less does it the same way. They know what that means. And then it's got a flexible platform where if I see something unusual, I can write a program and try it to see if it works with that person, and then treat that patient with flexibility.